What's up, peeps? Welcome in. This is Dr. Living Good. Welcome to the show. Natural remedies for joint pain relief, especially arthritic pain in those over the age of 40. What do we do for the joints? My 6 best foods. I narrowed it to 6. I had a tough time doing that. There's so many good things you can be proactively putting in your body to prevent damage to your joints. What are they? Well, let's break it down. Number 6, right out of the gates, one of my all-time favorites. It's turmeric. The curcumin in turmeric is so crazy good for inflammation. I love this, but the right form of it is very, very important. So this golden spice is found in many curries, like the curry dish, okay? It's a member of the ginger family. Ginger is another really good one that almost made the list. You could add in some ginger as well. Very good for the joints. Hails from India typically, or Indonesia. It's been a staple in traditional medicine for a really long time, for centuries. There's a lot of research that shows it blocks the proteins that cause inflammation. And it also eases the pain better than some non-steroidal anti-inflammatory drugs, NSAIDs, aspirin, Motrin, ibuprofen. Does it better. An herb does. Why are we talking about NSAIDs? Why am I seeing the Bayer commercial when this works as well and it doesn't have the side effects? And especially for rheumatoid arthritis, but if you have osteoarthritis as well, this is a big one to be putting in, okay? So research is very clear on it. Blocking those proteins is what turmeric does. You can get it in the root form. You can get it in the powdered form. The best way to absorb it, you're not what you take, you're what you absorb, is not black pepper. Don't scuff the stomach to try to get it absorbed. That's going to irritate, especially if you already have a lot of inflammation. Let's use fat. Emulsified turmeric, 40 times more absorbable, at least the type that I use. In some cases, up to 400 times more absorbable than just using the powder. Now, I like to add the powder to a smoothie or to a dish that I'm using, but on a daily basis, I'm taking absorbable emulsified turmeric with my omega-3. We'll talk about that in a little bit, but that's the type to get it in. Number 5, paced breathing and PMR. You might not have tried these either. Number 2, I don't think you probably have tried, but paced breathing and PMR. Taking slow breaths from your belly can calm and turn off the stress receptors that tighten your muscles and make your pain worse. So what this does is activating the brakes of your body and giving it a break from the accelerators of life. Stressors, deadlines, worries, anxieties. You hit the brakes by breathing 5-second deep breath in, 5-second deep breath out. Do it for a minute straight. It activates what's called your parasympathetic nervous system, which is your healing system, and shuts down your sympathetic nervous system, which is your stress inflammatory system. So we're literally firing up the system that does all the healing and lowers the inflammation, which is the parasympathetic nervous system, and you can stimulate it anytime with proper breathing. Plus, when you focus on your breathing, you can take your brain away from the thoughts and the pain. So focusing and refocusing on that, because you can't feel and have that thought process at that same time. Your brain can't process both of those. So I like to control my thoughts and direct them so that I don't feel the pain, because it's not taking in both of those thoughts. Now, PMR is progressive muscle relaxation. This can be done at bedtime. Hop into bed. You want to prevent some of that stiffness and soreness the next morning. You progressively work your way through the muscles of your body. And I like to start from the toes and work my way up. So you're crinkling those toes real tight, contracting the muscles, and then relax them. And then maybe the arch of your feet, and then you relax them. And then your whole ankles and your calves. And so it's these 3 to 5 second holds while you're breathing, and you slowly work your way up through all the muscles from the toes all the way to your face and your head. And it's called progressive muscle relaxation. By contracting that muscle, changing that blood flow, impacting the receptors, you relax the muscle, which lightens the pain and flushes a little bit of that inflammation out of the muscle. Less stiffness in the morning, but also helps you get better rest, which is going to make a big difference on your pain levels and inflammation levels. Let's go to number 4, Boswellia. Boswellia. If you haven't heard of this little guy, right? Journal of Rheumatology found that Boswellia, the herb, helps to reduce RA joint swelling. So if it can do it in rheumatoid arthritis patients, then all of us should be paying attention. I put this in my joint support. It's excellent, has a lot of research behind it at reducing and getting rid of this pain that is inside of the joints. So it's a great herb to add to the arsenal of fighting off pain and inflammation. Number 3, collagen. It's making up the connective tissue. So your joints, your tendons, that's all collagen. That's the building blocks, the protein that's provided. So if we have joints that are breaking down in OA, if we have inflamed joints in RA, if we have stiffness and swelling in the mornings, put some collagen in to give it more resources. Now, we need the cofactors with it, vitamin C, Copper, very important. Manganese, these are the cofactors that make sure collagen gets built. So taking collagen, grass-fed peptides, tested for heavy metals, with those three cofactors gives you the building blocks to be able to optimize the connective tissue of your joints. So we have this in capsule form in our joint support, otherwise collagen plus multi. It's a collagen plus a multivitamin to help get these cofactors in and the collagen in. There's different types. There's marine, there's bovine, there's chicken, there's eggshell. I have multiple types inside my capsule form and then the bovine type in my collagen plus multi. And you don't have to get it from me. I'm just saying this is what I use, but I make sure it's grass-fed, right? Or wild caught or free range when it comes to fish and chicken, and that it has those cofactors with it, and that it has been heavy metal tested to make sure there's not metals in it. Number two, might not have never tried this one, cold showers. Really? Yes. So cold therapy reduces pain, stimulates that parasympathetic nervous system again, just like breathing. Gets you a little like that, right? So are you sure Dr. Living Good? Because it feels like I'm stimulating my stress system. No, it actually calms down the stress system, believe it or not, and stimulates the parasympathetic, kicks in, because the body goes into more of a protection mode, and it will crank up that parasympathetic response, which helps reduce pain and inflammation, shows the studies. A cold shower. So what I do, especially in the wintertime, is I will crank down the shower, stand under it for a count of 30, right? If it hits the head, even better, but you want to target at least the back of the neck. This is where a lot of your receptors are, your vagus nerve, the great wanderer, kind of like Las Vegas, except VAGUS, comes down into your chest, controls your heart, controls your organs, controls your digestive system. A cold shower will properly lower the stress responses in your system, your parasympathetic nervous system. A cold shower, give that one a try tomorrow morning. Wake you up a little bit, but it will reduce the inflammation and the pain, get you going the right direction for the morning, okay? Number one. Omega-3, DHA and EPA, two most important food-sourced, fish-sourced forms of anti-inflammatories. This tops my list by far. The research is overwhelming. 750 milligrams up to 2,400 milligrams per day, as effective as an NSAID, aspirin, Motrin, ibuprofen, at lowering pain specifically in your joints. This is the one. So this has got to go in. I think this is for a lifetime, not a short time. And it's important for brain health, artery health, and it fights inflammation and pain. So eating fish is a great source 2 times per week. If you're not a fish lover, then we need to get a supplemental form of this in. I combine mine with the turmeric, or I have it by itself as well. I will take this a double dose, 1,500 milligrams every day, because it's so important to get healthy fats in. We get so many unhealthy fats and bombards our system that we want to make sure that we're putting those into the system in a proper form. Supplementing with it is important. So that might be driving unhealthy joints, unhealthy, pain in those joints. Using your body is going to prevent it from breaking down. So from a bonus perspective, keep moving, keep biking, keep walking, keep doing 10-minute workouts. If you don't use it, you lose it. And if your joints are really sore on the outside, rub coconut oil on them at nighttime, your knees, your elbows, where it's hurting you the most. It's going to stimulate blood flow. But if you let those seize up, you lack more blood flow, you're going to make the condition worse. So you actually want to keep moving with OA, with RA, and joint-related problems. And then using these nutrients, my top 6, there's my 7th for you. And if you want to know the real reason that you have stiffness in the morning, you might want to break down this video with my top 10 of why that's exactly happening and what you can do about it if morning stiffness is the worst problem. Check out this video next.